Hello, how are you? Good to see you again. Can you please verify your first and last name and your date of birth? Okay. Perfect. So I found you here in my system. And can you please tell me a little bit about what's going on? What kind of appointment do you need today? Okay. Go ahead, go on. Alright. You feel like something is stuck inside your ear. Okay. And for how long has that been going on? For a few weeks. Is there any pain? Okay. And have you noticed that your hearing is maybe impaired as well? Okay. Are you taking any daily medications? Okay. And how many milligrams of that? Is it once a day? PID? PID? And are you taking any inhalers? Do you have any respiratory problems? Okay. And when you expectorate, have you noticed anything coming out of your throat? Okay. And for how long have you had that symptom? And any pain around the nose area? Okay, any pain in the back of the throat? I am an ENT doctor, so all I do is to focus on ears, nose, and mouth. So that's what I'm going to be focusing today and examine you very detailed. Okay. I believe I do have a lot of information needed. So what I'm going to do is I'll just put some gloves and I will gently palpate your ears, your nose, and your throat and just make sure that everything seems to look normal upon palpation. And on a scale of 0 to 10, how would you rate your pain right now? Okay. Do you mind if I touch you? Okay. So first I'm going to go ahead and just touch your right ear. Is this okay? Okay. And I'll do the same thing on the other side. Okay. You seemed to have a facial expression when I touched you on the right side. Do you mind if I do that one more time? Yes, definitely. And you seem like you're having some pain on the mastoid bone as well. I'm going to go ahead and just type that. Make sure that we have mastoid bone tenderness. That could explain a lot of the diagnostics. So it's not very specific to one diagnostic or the other, but usually when patients do have mastoid bone pain, they present with mastoiditis, which is a bone infection, and it's pretty easy to treat, but it can be dangerous as well. It's very hard to detect. So what I'm going to do today is to make sure that you do not have mastoiditis, which would be a really bad diagnostic for you for today. Okay, but no worries. I am going to go ahead and just, take a step by step and examine you pretty good. Okay. All right. I'm going to go ahead and put this pulse oximeter on your finger. Index finger, is that okay? Okay. And can you please take a deep breath in and breathe out? Good. Your heart rate is 83 beats per minute, and your oxygenation is 95 percentile on room air, which is good. And I'm going to go ahead and listen to your heart. Okay. Okay, please. Just breathe normal for me, please. Okay. And do you mind if I slide the stethoscope underneath your shirt? Thank you. I can hear only S1 and S2. No S3, no S4. Let's go ahead and listen with the bell. Okay. No murmurs, and I'm gonna have you take a deep breath in and breathe out. Okay, and on the other side, take a deep breath in and breathe out. Go ahead and take your temperature. Just relax. .0 Fahrenheit. Okay. And do you have an arm preference? Let's go ahead and use this arm. I'm gonna have you pull your sleeve up. That's good. Oh, can you please uncross your legs for me? Thank you. Okay, that was really good. Let's go ahead and slide blood pressure cuff down your arm. I'm going to place it over here. Okay. And is it okay if I take a look inside your nose? All right. Let's go ahead and see what do we find in there, okay? So I'm gonna have you look up. Okay, let's go ahead and look on the other side too. Well, I did see something and I would like to remove it if that is okay with you. Okay? Alright, I'm gonna go ahead and go get my glasses and I'm going to go inside and try to remove the object, the foreign object, okay? So go ahead and stay where you are. Do not move. Okay. Alright, so I'm gonna have you look up and try to breathe through your mouth. Do not breathe through your nose, because if you breathe through your nose, my lenses are going to get kind of foggy, okay? Alright, so I'm gonna have you look up. You had a tiny little ball stuck inside your left nostril. Okay, and I was able to see one more. I think it's a different color. Okay, you had another ball. This one is white. I'm going to toss these. And let's go ahead and check a patency of your nose. So what I'll do, I will cover one nostril and I need you to take a deep breath in, okay? Okay. Okay, can you please take a deep breath in and breathe out? Good. Okay, and same thing on the other side. Take a deep breath in and breathe out. Okay, seems to be working perfectly normal. And let's go ahead and check your ears now. Is it okay if I take a look on this side first? Okay, I'm gonna have you look that way. Okay, I'm going to go ahead and switch ears now, so go ahead and look the other way for me, please. Okay, I'm going to go ahead and check your hearing. I have here a few tuning forks of different frequencies, and what I'm going to do is I'll start with the lowest frequency, and I'm going to ask you to tell me if you hear a high pitch, low pitch, and what kind of resonance you can distinguish. Okay. Okay, what does that sound like? It's pretty low. Okay. Let's try that again. Okay, can you tell me when you don't hear it anymore? Now? What about now? Can you hear it now? Okay, tell me when it stops, the sound. Stopped. Okay, go ahead and do that. Same thing on the other side, and now I need you to tell me which one here is louder position number 1, which is this one, or position number 2, which is this one. Number 2. Okay. Same thing. Which one here is louder? Position number 2, which is this one, or position number 1, which is this one. Number 1. Okay. I'll switch it up a little bit. So which position here is louder? A or B? Definitely B. Tell me when it stops. Okay. What about now? Can you hear it now? Okay. Tell me when you don't hear it anymore. Now. Okay. Tell me when you don't hear it anymore. Now. Okay. Alright, I'm going to try 256. So that should be a little bit. Okay. This one should be a little bit higher pitch. So can you tell me when you don't hear it anymore? Okay, can you tell me if you hear it left or right? Right. Okay. And can you tell me when you stop feeling the vibrations? Now. Okay. And what about now? Tell me when you stop feeling it. Okay. And which one here is louder? Position number 1 or position number 2? Number 2. Number 2. Are you sure? Okay, let's try that again. Which position here is louder? Position number 1 or position number 2? Number 2. Okay. What about now? Tell me when the sound stops. Stopped. And I'm going to go ahead and check your hearing a little bit more in detail, since I'm really not convinced that you do not have a hearing problem. I'm going to go ahead and make some sounds in your ears, and I need you to tell me when you hear the sound with left or right as well. Okay, so go ahead and close your eyes. Okay, close your eyes. Both. Left, right, both. Okay, what about now? Left, right, left again, right. Okay, what about now? Okay, and what about now? Okay, what about now? Alright. Both again. It's 1, 2. Okay. 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 I'm going to go ahead and do a whisper test. Have you ever had one done before? Alright. What I'm going to do is I will whisper some words in your ears, and I need you to repeat them back to me, okay? Okay. I'm just going to go ahead and type those words down before I give them to you. Okay, that's good. Melancholic. Melancholic. Good. Okay. And I will do a sensation test around your ears. Now this is going to be pretty simple. So what I'll do is I'll touch you with a soft surface. So I want to make sure that you feel even gentle touch. This is what it's going to feel like. Okay. And then I want to make sure that you also feel pain. So this is what it's going to feel like. And this is called sharp. Okay. Go ahead and close your eyes. Close your eyes. Close your eyes. And tell me if you feel sharp or dull. Sharp. Dull. Good. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Okay. So unfortunately, I could not find anything abnormal with your ears, but there was definitely something stuck inside your nose. We removed those. What I really need to do is to send them to pathology, make sure that we have them checked for any abnormal viruses, and I'll send you back the results within 24 hours. Is that okay? Okay. All right. Now, what I'm gonna do lastly is to check your mouth. So I need you to give me a big ah. Good. And again, big ah. Okay. So what I'll do is I will have you again open your mouth, stick your tongue out for me, okay? Just like that. Okay, good. And I'm not seeing any redness, and there's a little bit of sore throat, so you do have some redness in the back of your throat, but otherwise nothing too concerning. And yeah, like I'm not seeing any open sores, nothing that could actually explain your symptom, except for what we found inside your nose. And do you remember, stucking anything inside? You don't? Okay. But you have a toddler at home? That sounds dangerous. Okay. And what's going on? Oh, I see. Yeah, toddlers can push stuff inside our noses all the time, especially when we're taking a nap. That's so not fair. Okay. I'm gonna go ahead and write this down. Toddler alert. Okay. Well, what I'm gonna do is I will send those to pathology, and I will definitely give them a very good check for you, okay? Alright. Well, you have a wonderful evening, and please expect a phone call from me.